See that the front benches have swapped over, so we now start the statement on the National Cancer Plan. Minister.
Thank you. Madam Deputy Speaker, with permission, I will make a statement on the Government's National Cancer Plan for England. A cancer diagnosis changes you forever. When I was diagnosed with metastatic breast cancer 18 months ago, I didn't know if I'd be alive today. Never mind standing at this dispatch box announcing a national cancer plan. Yeah. But 1 year ago, almost to the day, the Prime Minister asked me to do just that. Madam Deputy Speaker, since the government took office, over 212,000 more people are getting a cancer diagnosis on time. Over 36,000 more are starting treatment on time. And rates of early diagnosis are hitting record highs. Despite these vital signs of recovery, the NHS is still failing far too many cancer patients and their families. That's why, first and foremost, this plan is a break with the failure of the last 15 years. In 2011, the coalition government published Improving Outcomes: A Strategy for Cancer. It was followed in 2016 by Achieving World-Class Cancer Outcomes: A Strategy for England. In 2019, the Long-Term Health Plan for England made cancer a priority and included a headline ambition to diagnose 75% of cancers at stage 1 and 2. However well-intentioned, not one of these strategies have lived up to their promises. Cancer mortality rates in the UK are much higher than in other comparable countries, while survival is much lower. Cancer incidence is around 15% higher than when the 62-day standard was last met. And working-class communities are being failed most of all. The most deprived areas, including rural and coastal communities, often have fewer cancer consultants, leaving patients waiting longer. And it all adds up to the chilling fact that someone living in Blackpool is almost twice as likely to die young from cancer than someone living in Harrow. Madam Deputy Speaker, wherever you live in our country, you deserve the same shot at survival and quality of life as everyone else. Yeah. Wealth should not dictate your health, and neither should your postcode. And behind these statistics are real people. I've heard from those whose care lacked empathy and dignity, whose cancer was missed or test results lost, who were passed from pillar to post and kept in the dark about their condition, and those whose loved ones died before their turn came for surgery because the wait was too long. Those experiences are unacceptable. Yeah. They are devastating. And from day one, I was determined to put their voices front and centre of our plan. Yeah. Over the past year, we've listened to and learned from cancer charities, clinicians, and most importantly, patients and their families. Every action is a response to someone's lived experience. Every commitment is a promise to transform someone else's life. And their stories have become the blueprint to make the biggest improvement in cancer outcomes in a generation. Madam Deputy Speaker, 3 major themes stood out from the 11,000 responses to our call for evidence, around 9,000 of which came from patients and their carers. First, on core performance standards. Second, improved survival. And third, quality of life after diagnosis. And Madam Deputy Speaker, these are not radical ideas. But unlike previous strategies, this plan is not limited to incremental improvement. Instead, it is an ambitious, bold plan to save 320,000 more lives by 2035, the fastest rate of improvement this century, by modernising the NHS, harnessing the power of science and technology, and putting our patients at the front of the queue for the latest medicines, while helping them to live well after diagnosis. Not least for people diagnosed with stage 4 metastatic and incurable cancers, people like me. So how do we get there? We're placing big bets on genomics, data and AI, as set out in our 10-year plan for health. And we will hardwire the 3 shifts of our 10-year plan into cancer pathways. First, on analogue to digital. We heard from patients about the importance of clinical trials. So we will make the UK one of the best places in the world to run a trial with a new cancer trials accelerator. We will start people's care earlier using liquid biopsy tests, which can turn results up to 2 weeks faster than conventional testing. We will harness AI to read scans, plan radiotherapy and identify the right path for each patient. We'll harness genomics so every eligible patient will have access to precision medicine. And we will harness data as we make sure all metastatic disease is counted properly, starting with breast cancer, so that people with incurable cancer are properly recognised and supported. When you're not counted, it feels like you don't count. We will end that. Innovation will also help us fight inequalities and make the shift from sickness to prevention. We'll turn the NHS app into a gateway for cancer care. By 2028, it will host a dashboard for cancer prevention with access to tests and self-referral. And by 2035, it will bring together genomic and lifestyle data with the single patient record to advise every patient according to their risk. This will benefit people in rural and coastal communities that can find it difficult to access specialist care simply due to geography. Finally, we'll use the neighbourhood health service to make the shift from hospital to community. That means more care, more pre-habilitation to recovery support will be delivered closer to home. We'll help people live well with cancer through tailored support closer to home. People will be given personal cancer plans, named neighbourhood care leads, and a clear end-of-treatment summary so no one feels abandoned after their treatment. Madam Deputy Speaker, for too long, those with rarer cancers have seen little to no progress for many of their conditions. They told us we need a special focus on these cancers, and our plan sets out how we will benefit from the deployment of genomics, early detection and the development of new treatments. Asked for by patients, delivered by this government. And I can pay tribute to the campaigning of my honourable friend, the member for Mitcham and Maldon, for her campaigning in memory of her late sister Margaret. We should also remember that the late Tessa Jowell raised this issue in 2018 and her family's campaigning ever since. Our plan also gives pride of place to children and young people. We'll improve their experience of care at every level, from hospital food to youth worker support and play support. And I pay tribute to my honourable friend, the member for Leighton and Wanstead, for his campaigning on this point. Our Children and Young People Cancer Task Force asks for support with travel costs, because when your child has cancer, the last thing you want to worry about is how you're going to pay for your train ticket. So today I can announce that we will fund those travel costs. And alongside rare and less common cancers, we will make research for children and young people a national priority. I want to take this moment to thank the children, young people and families that made up our Children and Young People Cancer Task Force. It was a pleasure and a privilege to meet with them earlier this week. And I thank the families and loved ones of people lost too soon that continue to fight to make change for others. I'm so grateful to them. And as people read this plan, it's their voices I want people to hear, because this plan is rooted in the voices of patients, families, clinicians and charities. It will turn cancer from one of this country's biggest killers into a chronic condition that's treatable and manageable for 3 in 4 patients. It delivers the ambition of the 10-year health plan, embodies the government's 3 shifts and sets a clear path towards earlier diagnosis, faster treatment and world-leading survival rates by 2035. But this plan doesn't belong to the NHS, and it doesn't even belong to this government. It belongs to us all, and we must all play a part in making it work. Over the past year, I've met with the patients, families, carers and clinicians, researchers, cancer charities and voluntary groups who have all contributed to this plan. This government is on their side. We wrote this with them and we can't deliver it without them. Let's do this together, and I commend this statement to the House.
Shadow Secretary of State.
Thank you very much, Madam Deputy Speaker. And can I thank the Minister for her advance sight of her statement. Can I say right at the outset, we share the ambition to improve cancer survival and outcomes. Almost every family in Britain has been touched by cancer, and patients do deserve timely diagnosis, treatment and proper support. I also want to recognise the Minister's personal experience and the commitment that it has clearly brought to this agenda, and we on this side of the House wish her every success for the future. And can I also join her in thanking all those that have taken part in the shaping of this. It does make a big difference when we hear the voices of patients and families that have been through these experiences. The National Cancer Plan sets out major commitments, including early diagnosis, improving performance against cancer waiting time standards, faster setup of clinical trials and the national rollout of targeted lung screening. Now, it also talks about modernising services through technology and innovation. Now, as Cancer Research UK has said, there is much to welcome in this. But as I've also said, it's right for them to say that delivery, funding and accountability will determine whether patients see change. So, because too often plans do sound impressive on paper, but fall short when it comes to clear, published delivery milestones and accountability. In many respects, this plan mirrors the ambitions of the 10-year NHS plan, strong on aspiration, but light on the detail about how change will actually be delivered on the ground. So my first question is simple. When will the government publish clear, funded milestones showing how and when patients will see improvements in the next year or two? We welcome investment in diagnostics, technology and innovation. It is also right to recognise that this plan builds on the significant expansion of diagnostic capacity delivered by the last Conservative government, including the rollout of over 160 community diagnostic centres. Earlier diagnosis on this scale is only possible because of that foundation. But technology is only meaningful if it translates into real capacity and quicker treatment for patients, and that is why radiotherapy matters. Radiotherapy UK is right that it is a core part of modern cancer care that relies on up-to-date equipment and a skilled workforce. So my second question is this: will ministers set out how the plan will expand radiotherapy capacity in practice, including equipment replacement and workforce, so that patients can benefit in reality rather than just something written on paper? And are we learning the lessons from the Danish example, who put investment into radiotherapy and saw significant improvements over a period of years? And that brings me on to the workforce. The success of this plan depends on cancer nurses, radiographers, pathologists and oncologists who are already under immense pressure. We've heard big promises before, but less clarity on delivery. And so my third question is this: where is the fully funded long-term workforce plan to deliver the staffing needed to expand diagnostic and treatment capacity and sustain improvements, including in neighbourhood health centres, and to explain clearly who will staff them and how they will be funded? Blood Cancer UK has highlighted the importance of ensuring blood cancers are properly recognised in planning, and that patients receive consistent support from the point of diagnosis, including access to a named healthcare professional. And that underlines why delivery and accountability across the system matter so much to patients. Can I also welcome the commitments in this plan to children and young people? And I want to pay tribute to my honourable friend, the member for Gosport, who I know did some incredible work in this. Having worked in children and young people's hospices, you can never forget the journey that those children and their families go on, and I'm really grateful to the government for having a big section on that. My fourth question then is about life after and at the end of treatment. The plan rightly talks about improving quality of life and support after treatment, including personalised support and rehabilitation. We all want people to live longer, but for many patients and their families, hospice and palliative care are essential. Yet hospices across the country are under severe pressure, with now many in crisis, exacerbated by recent government tax rises, hitting staffing and running costs. They are hospices are notably absent from today's statement. So will the government urgently convene a crisis meeting with the hospice sector and set out what immediate steps it will take to stabilise services and expedite delivery of the palliative care plan? We will support any serious deliverable reforms that improve earlier diagnosis, speed up treatment, strengthen the workforce and improve patient experience. But we'll also hold ministers to account for turning long-term ambition into real improvements now, because we do want to see the patients getting the care that they need. Minister.
Thank you, and I thank the the honourable member for his statement and questions, and particularly for his personal wishes. Thank you. Thank him indeed. On the overseeing of delivery, it is absolutely crucial. You know, great, we've written a plan. What matters is delivering it. And, you know, we started delivery even before we'd finished writing this plan. We're not waiting. We've already put 200 million directly to cancer via cancer alliances. We've recruited 2,500 more GPs. We've put in place 28 cutting-edge radiotherapy machines already and are already rolling out lung cancer screening. We've opened more community diagnostic centres at evenings and weekends. We said we'd deliver 2 million more appointments. We've already delivered 5 million more appointments. And we've put £25 million into the NIHR Brain Tumour Research Consortium. So there's already steps that are being taken. And it is really important, as he points out, that we are held to account and that people keep our feet to the fire on delivery. That is why we are setting up a brand new cancer board of charities and clinicians that will oversee the delivery of this plan and keep our feet to the fire. On workforce, we know how important it is to make sure that the cancer workforce is grown and developed, not only just in numbers, but in terms of being able to have the resources and the support to use their skills to the utmost. The workforce plan that the government is developing will also include cancer and will be published in the spring of this year. I was delighted to hear the honourable member mention rare cancers and children and young people. This is the first ever cancer plan with a chapter on rare cancers. It's the first ever cancer plan with a chapter for children and young people, and I'm really proud of that. In terms of radiotherapy, as I said, we've invested 70 million into 28 new LINAC radiotherapy machines, and we've listened to stakeholders in the radiotherapy community. We're investing in new technology, including those radiotherapy machines, and in AI, which assists the oncology workforce to reduce the time it takes to plan and then deliver treatment. And by April next year, we will streamline the process to make it easier for radiotherapy centres to use cutting-edge stereotactic ablative radiotherapy, SABR, which I know is of crucial importance to many patients. And we're also going to ensure a payment system associated with this treatment incentivises rapid adoption. The honourable member mentioned hospices, which I know is very close to his heart and his experience. We are delivering the biggest investment in hospices in a generation. We've provided 100 million to upgrade buildings, facilities and digital systems, and we're giving a further 26 million to children's and young people's hospices, ensuring they can continue offering specialist compassionate support. More broadly, we are developing a palliative care and end-of-life modern service framework for England. It's currently being developed alongside our stakeholders with a planned publication date of autumn 2026. I hope that addresses most of the issues raised by the honourable member. I'm more than happy to speak with him further after the debate.
Clive.
Thank you, Madam Deputy Speaker. Could I really welcome this plan and the particular efforts of my right honourable friend for getting it together. Could I just raise one particular credit and one request to go a bit further? First of all, when I had my cancer treatment 8 years ago, I thought I knew my way around the NHS, but it's a completely confusing organisation for anyone involved in it. But one of the things that really helped me was having a specialist nurse appointed at the beginning. That specialist nurse got my chemotherapy ready on a Monday before I came down to London, and then on a Thursday when I came back. That sort of organisation, that help is really vital, so I really welcome that proposal. Could I just go a bit further in terms of cancer for young people? When I had my stem cell transplant for myeloma, my own stem cells were used and harvested, but for many young people with complicated blood disorders, they need stem cells to be donated. We should work with the Anthony Nolan Trust, and I'm chair of the APPG, to ensure that more young people donate their stem cells so other young people can have a life to look forward to.
Minister.
I thank my honourable member for his question and for his expertise and all that he's shared from his experience in helping us develop this plan, and note how important the specialist nurses are. We're also doing even more to help people navigate the NHS I know exactly what it's like, Madam Deputy Speaker. I have in my Filofax, I'm that retro, about 38 emails and phone numbers of the various people I have to contact in order to personally project manage my treatment. We're going further and making sure that the NHS app can handle all of that information, and cancer patients will have it in their hand, in their pocket, to manage scans, appointments and test results directly through the NHS app. And I am delighted to say that my honourable friend, the Minister for Innovation, is already looking at the issues he raises around blood products and donations, and is working with the Anthony Nolan Trust on these, and I'll be more than happy to work with him further on those issues.
Liberal Democrat spokesperson Helen Maguire.
Thank you, Madam Deputy Speaker, and I thank the Minister for advance sight of the statement and for her personal experience that's gone into this plan. After the Conservatives failed to invest in our NHS, it's no surprise that cancer survival in the UK is still around 10 to 15 years behind leading countries, with worse survival rates for some cancers than Romania and Poland. So I'm pleased that this government listened to my honourable friend for Wokingham and brought this National Cancer Plan to life. Because cancer touches everyone. One of my residents, a mum with a young family, discovered a lump in her breast. Despite attending the one-stop breast clinic on 4 separate occasions, it took 2 horrendous years for her to be diagnosed with breast cancer. When she was finally diagnosed, the cancer was aggressive and required a mastectomy, chemotherapy and radiation therapy. This is why I welcome the government's target on meeting all cancer wait time standards by 2029. But the aim to halve the backlog in 3 years' time is not ambitious enough. So will the Minister go further and back a Liberal Democrat plan to write into law a guarantee for all cancer patients to start treatment within 62 days from urgent referral? The focus on ending delays in cancer care is a step forwards. However, funding for 28 new radiotherapy machines is not enough, particularly when this treatment is so cost-effective and successful. We need to end radiotherapy deserts. So will the Minister extend her ambition to 200 extra radiotherapy machines? The Minister says the plan will turn the NHS app into a gateway for cancer care, but how will the Minister support the digitally excluded and older people? The plan promises to drive up productivity, end the postcode lottery, expand NHS diagnostic capacity, introduce personalised cancer plans and more. This is optimistic and will require more investment to increase NHS capacity, but without clear funding and capacity building plans, is this realistic? Will the Minister confirm? Labour was right to put patients at the heart of this plan and incorporate the Liberal Democrat calls for a specialist cancer nurse for every patient. We costed for 3,000 extra cancer nurses. How many additional cancer nurses does the Minister believe are needed? And finally, will the Minister confirm that the plan's annual summary of progress will be reported in the House for members to scrutinise? Thank you.
Minister.
I thank the honourable member for her question. We listen to a lot of people about the need for a cancer plan, and I just want to take this opportunity to say that it was our friend Nathaniel Dye, who sadly died last week from stage 4 bowel cancer, that challenged my right honourable friend, the Secretary of State for Health and Social Care, back when we were in opposition, to bring forward a cancer plan. And he made that commitment right then, and we've brought that forward 18 months after coming into government. We understand in terms of the NHS app, as she's raised, that is not necessarily relevant for all those people that might feel or be digitally excluded. But one of the reasons we bring this forward is to be able to open up capacity within the rest of the system so that those that can use digital tools can, freeing up capacity for that one-to-one, face-to-face support that many people need. But every cancer patient will get that support under this plan, whether it's through the app or through their named lead clinical specialist in their neighbourhood, supporting them throughout the process, including after treatment. We are working with the NHS, with NHS England at the moment, to identify numbers around cancer workforce, and we'll be able to announce more around that as the workforce plan develops. Thank you.
Ben Goldsborough.
Thank you very much, Madam Deputy Speaker. 388 days ago, the words were uttered to me, "You have stage 2C skin cancer." That's 388 days of scans, operations and treatments that didn't need to happen because preventative care could have stopped me from getting skin cancer. That's why today's statement is so important, because Action 30 within the document focuses on melanomas and skin cancers. And it means a huge amount to me personally that the government has taken this so seriously. My ask of the government is, when we're undertaking the reviews into UV and preventative skincare, that we look at the examples of Australia and other neighbours who do take this seriously, so we can ensure our young people and adults know how to stay safe in the sun.
Minister.
I thank my honourable friend for his question and commend the work that he's doing on this area whilst himself going through treatment for skin cancer. Action 30 is really important, and we're also committing in this plan to challenging and tackling underage sunbed use, and we are committing to look more at what we can do further to combat dangerous sunbed use and promote prevention when it comes to skin care in the sun. We'll explore further what we can do around that, and I look forward to working with my honourable friend in order to do that.
Sir Edward Leigh.
Whilst cancer incidence in Lincolnshire is about average, premature mortality is higher, and you only have to look at a map of England to see the north-south divide and the rural-urban divide. Now, I want to ask about prostate cancer. I don't want to get into the debate about national screening, because that's been well aired, but it's not generally known by men that any man over the age of 50 can go to their GP and demand a PSA test. And it seems to me that as part of this programme, we should encourage all men every year to ask, not just for a PSA test, but also a general blood test as well, and women generally also. And irrespective of national screening programmes, if everybody did that, given with a condition like prostate cancer that your rates of survival are incredibly high with early detection, is that not something we should be encouraging?
I thank the honourable member for his question and agree with him that prevention is absolutely key. We can't prevent all cancers, but we can do much to prevent cancers being caught late, and therefore by getting to them when they are more treatable. We do encourage all eligible people to access the tests and screening that are available to them. And the new NHS app will also, each individual will be able to get a personalised risk factor to be able to identify what they may be at risk of, and nudging them to which tests and screenings they should be asking their GP for. So that's something we are looking to develop for all cancers, including prostate cancer. We're also expanding access to life-extending prostate cancer drug, abiraterone. I can say mine, that's capecitabine, abiraterone, and to get thousands more men earlier effective treatment that can significantly improve their chances of long-term survival. So prevention and catching cancer early is something that we are intending to do through this plan, and included within this plan is raising the awareness of cancer across all communities to make sure people are accessing the screening and the early tests that they're in.
Josh Fenton-Glynn.
Thank you, Madam Deputy Speaker. This Tuesday would have been my brother Alex's 54th birthday, but sadly we lost him to cancer last year. That's why I'm really proud that this plan will revolutionise treatment, care and research into cancer, as well as focusing on rare cancers like the ones that killed my brother. While I'd like to pay tribute to the doctors and nurses who are responsible for looking after my brother, I think it's fair to say that sometimes with cancer at the moment you get treatment but you don't get care. And actually, one of the things that's most exciting about this plan is the section on getting cancer treatment to fit around people's lives. Because Alex spent too long waiting for letters, too long having to be his own advocate, his own professional patient. Could the Minister please explain to me what more we're going to do to make sure that we don't just treat the symptoms, but we care for the patient?
I thank my honourable friend for his question and commend the work that he's done campaigning in his brother's name around the area, particularly of rare and less survivable cancers, including brain tumours. You know, putting patients at the centre of this plan, that's why we've got the plan that we've got. And it's why this plan says that not only will every patient have a personalised cancer plan, treatment plan, they'll be at the heart of deciding what it is. They will have a role to play with their clinicians, deciding on what treatment works for them. I know personally what that means. When I got my diagnosis, immediately the suggestion was that I would have intravenous chemotherapy. I was able to engage with my oncologist and say, I'm not sure that that works for my lifestyle. I want to be able to live my life as well. And we were able to work together to find the right treatment that fitted in with my lifestyle, that allows me still to come to work and do this job. That's what we want for every single cancer patient in this country, that their treatment is not just about keeping them alive, but it's about extending and maintaining their quality of life as well.
Sir John Whittingdale.
Thank you, Madam Deputy Speaker. The league table of NHS trusts shows that the percentage of patients starting treatment of cancer within 62 days in Mid and South Essex is 21%, which puts them bottom at number 121 out of 121 trusts. So can the Minister say what additional help will be given to the Mid and South Essex NHS Trust to recruit the additional staff they need and to help them to meet the targets which she has just set out?
I thank the honourable member for his question, and the particular trust to which he refers is the trust where I had my primary cancer treatment. So I am acutely aware of the challenges in those trusts. We've set a really clear and simple ambition, which is to get cancer patients the timely care they need and meet all waiting time standards by the end of this Parliament. And that means that by March 2029, 80% of patients are going to be getting that diagnosis or the all clear within 28 days, and 85% of patients will start their treatment within 62 days of referral. Some people have asked me, why is that not 100%? It isn't possible to make that 100% because not everybody's cancer is simple or easy to identify, and sometimes it takes longer. But we want to make sure that the only reason that there are delays beyond those 62 days is because of the complexity or the specifics of your cancer, not because of the inability of a trust to meet the targets. We're going to be cutting waiting times by giving trusts and cancer alliances detailed practical information, granular data for individual cancer types so that we can highlight real-time pathway insights through a federated data platform, and by streamlining the cancer metrics so we can shine a light on unwarranted variation in care, and providing that information and best practice, taking the best of the NHS to the rest of the NHS, linking up professionals and clinicians across the UK so that they can share their best practice and that trusts can help and support each other to reach those targets.
Dr. Peter Prinsley.
Thank you, Madam Deputy Speaker. What a brilliant plan, and I congratulate the Minister on bringing it to the House this afternoon. But cancer trials need clinical academics, and we have a crisis in clinical academic recruitment, retention and funding. Now, does she agree with me that we must find ways to encourage young clinicians into academic and research roles?
Minister.
I thank my honourable friend for his question. Yes, I do, and we are working to do that. We're establishing the Cancer Trials Accelerator programme to increase the speed, scale and reliability of cancer trials, and we'll use the new Health Tech Access programme to make it quicker, and we'll be supporting the development through the workforce plan of all clinicians required, including academics.
Pippa Heylings.
Thank you, Madam Deputy Speaker. This weekend I got the devastating call about my brave and wonderful sister, Dawn, loving mother and carer to Ella, who after a dash to A&E was diagnosed with late-stage pancreatic cancer and just given 3 to 6 months to live. What links less survival cancers is their late diagnosis. So does the Minister agree with my amazing sister Dawn and me that we need to be more proactive about early diagnosis of less survival cancers, such as the annual screening of those with family history or high-risk genetic factors, so that they can improve the ability to detect and remove tumours early and improve the 5-year survival rates, which sadly hers is not, but to over 50%. Thank you.
Minister.
I thank the honourable member and may offer my deepest condolences with the news that she shared with the House today. I do share her concern that we have to reach, some less survivable cancers can be tackled if they are caught early. And we have specifically committed in this plan to significantly reduce the number of rare and less survivable cancers that are diagnosed in an emergency setting, which is something that she has described has happened to her family today. Primary care is where most people first raise concerns. GPs rarely see rare cancers because they are rare. So we're rolling out AI-driven decision support tools to help GPs think cancer sooner, think cancer earlier, and make decisions about referral quicker.
Rachael Maskell.
Thank you, Madam Deputy Speaker. May I also thank the Government for bringing forward this cancer plan, and also having visited the Leveson Centre, York Against Cancer, last Friday, really welcome the holistic care that they give to cancer patients. I just want to highlight prevention. Prevention, we know 4 in 10 cancers are preventable, and with the right interventions it can be transformative, particularly for those people of low socioeconomic communities. So will she talk a little bit more about the public health approach that will be taken? Because in York we've seen a 30% cut in our public health budget over the last 10 years, which means there's less resource available to prevent cancers.
I thank my honourable friend for her question, and prevention is a key part of this plan, and we're doing an awful lot on that, which I've mentioned already, the illegal underage sunbed use, for instance. We're also eliminating cervical cancer through HPV vaccination and tackling obesity, and fundamentally creating the world's first smoke-free generation with our groundbreaking tobacco and vapes bill. We don't ignore communities hit hardest, and the Cancer Alliances are promoting new catch-up schemes to enable young people to catch up on vaccinations like HPV that they may have missed. And we're tackling harmful alcohol consumption by introducing new mandatory health warnings and nutritional information on alcohol labels. We have reformed the public health grant in recent years. We have wrapped it up, and in many places there's seen an overall increase, but we're also giving local authorities more flexibility to use their public health grant, and with, for the first time in many years, multi-year settlements so that they can plan.
Members will know that this is a very important and sensitive and sometimes personal statement, but can I just remind members that we've also got 2 debates that are important after this, so please keep your questions short. Martin Vickers.
Thank you, Madam Deputy Speaker. Further to the exchanges earlier about radiotherapy, I understand that the national figure for access to radiotherapy is 53%, which of itself doesn't seem particularly high. But in my Brigg and Immingham constituency, which falls in the Yorkshire and Humber region, that is only 35%. Could the Minister give some assurance to my constituents about progress on increasing that figure? When do you think we can reach the national average?
Yeah.
I thank the honourable member for his question. Through the spending review, providers have been allocated £15 billion in operational capital for local priorities and £5 billion to support the return to constitutional standards on radiotherapy. Responsibility for purchasing new machines sits at a local level, and we expect local systems to continue to invest in new machines in order to meet the ambitious targets and meet their local need.
Pam Cox.
Thank you, Madam Deputy Speaker. And I really welcome the National Cancer Plan and the Minister's clear personal determination to bring it to fruition. Would the Minister agree with me that local innovations are going to play a really key part here? Innovations like the prehabilitation service in Colchester, which gets patients ready for treatment before their treatment begins. Would she and her team like to visit that and other services locally to see the impacts of that for herself?
Minister.
I thank my honourable friend for a question. Yes, I do agree with her. And this plan is about that wraparound care and making sure it's from the very beginning. And I'd be more than delighted if Diary allows to come and visit the service that she mentions.
Forster.
Thank you, Madam Deputy Speaker. Yesterday, for World Cancer Day, I hosted Woking's Walk the Walk here in Parliament. They're a national charity that I'm proud that are based in my constituency. They've raised over 146 million for charity to fight cancer but help people with healthy lives. Now, I'm sorry the Secretary of State couldn't join us for the full statement, so I'm sorry that he's not in his place. But I would ask the Minister to ask the Secretary of State to choose his favourite bra and join me in my... to join me on the Walk in his favourite bra, with me in my favourite bra so we can raise awareness for mammogram testing, as well as will she ensure that mammogram testing is extended to the under 40s and the over 70s?
Minister.
Well, sometimes we often quite look forward to getting to this dispatch box and making promises for our colleagues on the front bench. But I think at this point, I would just gently encourage my right honourable friend, the Secretary of State for Health, to join you, if that is something he's able to do. And look forward to seeing the photographs of that particular event. In terms of screening for breast cancer, we are exploring what the opportunities are around that. There are particular difficulties in terms of early screening, in terms of dense breast tissue, but we're expanding screening where it supports this. And in particular for breast screening, we're monitoring emerging evidence from the Brigg trials that target programmes at women with greater risk. And we're also considering the findings from the 11 million Edith trial, testing how cutting-edge tools can be used to catch breast cancer cases earlier, particularly younger women who, like me, for whom mammogram was not successful because of dense breast tissue.
Thank you, Madam Deputy Speaker, and can I join others in thanking the Minister for all the work on the National Cancer Plan. Last week I was lucky enough to visit the brand new NHS Community Diagnostic Centre at the National Health Innovation Campus at Huddersfield University, and on the second floor of that building diagnostic radiographers are being trained as well. And on top of that, can I welcome the work of Calder and Huddersfield NHS Trust, who are ranked one of the best in the country for meeting cancer performance wait times. So can I ask how we will learn from that best practice across the country?
Minister.
I thank my honourable friend for her question and for her highlight of such amazing work that's happening in her constituency. And from the very beginning, we've said that this government's approach is to take the best of the NHS to the rest of the NHS, and using the NHS app and using the new national coordination of activities, we're hoping that we can start to share some of that best practice a lot more widely.
Greg Smith.
Thank you, Madam Deputy Speaker. I very much welcome the plan. I see the Minister's commitment to this, and I absolutely hope, in the interests of all of our constituents, it works and comes through. In the last Parliament, I did a lot of work in the then APPG that doesn't exist anymore on minimally invasive cancer therapies. That's one area, notwithstanding the commitment to innovation and technology the Minister has outlined. It's an area I haven't heard much about. So could she outline to the House how this plan is going to bring through faster, on less of a postcode lottery basis, those new minimally invasive therapies?
Minister.
I thank the honourable member for his question. Harnessing technology right across the cancer landscape is what this plan is about, and where appropriate, where those less invasive treatments can be used, we're looking to explore how we can roll those out where appropriate across, regardless of postcodes. Because what's really important is, lots more people are surviving treatment. They're surviving cancer with treatment, but the side effects of invasive cancer treatment can be significant. I know I have several of them. And so where possible, we want to be able to use those innovative, less invasive treatments so that people can live longer and more fruitful and less painful lives.
Amanda Hack.
Thank you, Madam Deputy Speaker, and I thank the Minister for her really powerful statement. It's clear that there are differences in cancer treatment depending on where you live, whether that's in a rural or coastal community. My semi-rural constituency of North West Leicestershire sits on the edge of 3 hospital trusts, so constituents like the one who visited me at my coffee morning earlier this week highlighted the difficulties of her cancer treatment, getting consistency from a Leicestershire GP but getting care from Derbyshire and Burton Hospital Trust. Will the Minister set out more on the neighbourhood element of the treatments addressed in the National Cancer Plan?
Minister.
I thank my honourable friend for her question. And, this cancer plan sets out policies that are specifically developed to tackle geographic inequalities in cancer care, with increased medical training places in rural and coastal areas, improved data transparency on the quality of care and performance of trusts, and investment into cancer alliances who proactively support local communities, neighbourhood treatment support, neighbourhood based lead support individuals will help people navigate the cancer pathways on which they're on, and cancer outcomes should not be dependent on your location in the country. So we're working to bring those to an end. We're using the NHS app so that patients can manage their cancer treatment themselves, but also in a wider sense in terms of what we announced in the summer for the National Plan for the 10-year Plan for Health, a single patient records will allow patients to more easily access services, particularly across different ICBs.
Liz Saville-Roberts.
Does her department have a procurement strategy to ensure security of supply of medical radioisotopes, which are so critical for diagnosis and treatment? And could she provide details of cooperation and assessments made by her government with Welsh Government on Project Arthur, the isotope reactor scheme at Trawsfynydd?
Minister.
I thank the honourable member for her question. I understand that she has already met with the Minister for Innovation on these issues. He will continue to work with her on those and will explore them further.
Blair Anderson.
Thank you, Madam Speaker. Can I congratulate the Minister on this excellent plan? And invite her to congratulate Young Lives versus Cancer, who have been campaigning for the travel fund for young people and children with cancer for so long. And I've been joining them in that campaigning and absolutely delighted to see that travel fund there. And can she confirm that she will continue to work with Team Margot and with the Anthony Lowland Trust to increase stem cell donation from people from ethnically diverse communities where there is a shortage, in memory of Margot, who died from leukemia aged 2. Thank you.
I thank my honourable friend for her question, and yes, I can confirm that, and we will continue to work with cancer charities. I'm particularly delighted with the work we've done with Young Lives and other young people's cancer charities, bringing amazing insight and basically writing the chapter on children and young people and cancer with the team. So I'd be delighted to continue that work.
Clive Jones.
Thank you very much, Madam Deputy Speaker. I was the first MP in this Parliament to call for a national cancer plan back in October 2024. So I congratulate the Secretary of State and the Minister for publishing the plan. There are some good things in the plan: a concentration on children and young people's cancers, a concentration on rare cancers and less survivable cancers, and more desperately needed screening. Targets in the plan are also to be welcomed, but if they're going to be met, then there is a need for workforce expansion, especially in oncology, pathology, radiology and clinical nurse specialists. The extra cash that the Secretary of State has obtained for the plan from the Treasury is not enough to achieve all of his ambitious plans right away. So, how will the Secretary of State and the Minister get the money needed from the Chancellor to make this plan a success?
Minister.
I thank you for his question. And yes, as I've already stated, workforce is key, and the workforce plan will be published in spring this year. But as of November 2025, there are now 70% more staff in the key cancer professions of clinical oncology, gastroenterology, medical oncology, histopathology, clinical radiology, diagnostic and therapeutic radiology than there were in 2010. So we are starting to make inroads. We know that there's further to go, and we'll be driving that forward with this plan and the workforce plan due in the spring.
Luke Meyer.
Thank you, Madam Deputy Speaker. I want to pay tribute to my constituents, like Melissa from Gainsborough, who campaigns on lobular breast cancer, or Georgia from Hemington, who campaigns on cervical cancer, or Peter from Colby Newham, who campaigns on prostate cancer. What message does the Minister have for them? What assurance does she have that the resources will be put into communities like mine to tackle health disparities and make sure that everyone, no matter where they live, can get the cancer care that they deserve?
Minister.
I thank my honourable friend for his question and would like to commend all of the campaigning work of his constituents and say to them their voices run through this plan. They have written this plan with their campaigning activity as much as we have. I'm also aware that my honourable friend's own hospital has had funding for 2 of the new LINAC machines at James Cook Hospital, which is helping make sure that people get access to treatment. This plan makes sure that postcode and geography will not get in the way of the treatment that you get, and I look forward to working further with him and his constituents on how we can make this a reality.
Sarah Jeremy.
Thank you, Madam Deputy Speaker, and can I congratulate the Minister on this really excellent piece of work. It's absolutely crucial to my residents in West Norfolk, where we have statistically the worst hospital in the country at the Queen Elizabeth in King's Lynn, not in a big city but in a rural part of West Norfolk. Can I ask the Minister to reassure my residents that unlike the last government that created a postcode lottery with many more rural communities missing out, that this will be a truly national cancer plan covering all parts of our great country?
Minister.
I thank my honourable friend for his question. And, you know, we recognise that the provision of cancer services varies significantly across the country. And this plan sets out how we're going to end that variation by bringing healthcare to the community and ensuring that everyone, no matter their postcode, has access to high-quality cancer care. I want to assure everybody that cancer outcomes should not be dependent on your location in the country. And we will make timely access to high-quality diagnostic and treatment services a reality for anyone and everyone that needs it.
Tessa Mons.
Thank you, Madam Deputy Speaker. I'd like to welcome the statement and the plan, and to salute the Minister's bravery and wish her very good health. My constituents don't get a particularly good deal. When measured against the 62-day standard, it's 47% who meet that standard for radiotherapy, 62% for the drugs, and 73% only for surgery. But looking at just the first treatment masks the real picture, the true picture. Combination of treatments is very often crucial to survival, and waiting 6 months for your second treatment is really poor. So can I ask the Minister to consider bringing in measurement of the secondary treatments? We know that radiotherapy can reduce a tumour and that surgery comes later, but if you have to wait 6 months for the surgery, you're in trouble. Thank you.
I thank the Honourable Member for a question. Yes, we are aware of that, and we're looking at the existing metrics and what we can do to improve those to make sure that they're actually making a difference to people's outcomes.
Josh Newbury.
Thank you very much, Madam Deputy Speaker. In welcoming this National Cancer Plan, I'd like to pay tribute to my phenomenal Auntie Hilary, who passed away in September 2020. A GP practice manager, her selfless focus on making sure that her elderly and vulnerable patients were okay during the first lockdown meant that she put off getting the early symptoms of her own cancer checked out. She got rapid treatment, but sadly it was too late. Will my incredible honourable friend confirm that the direction and investment set out in this plan will make sure hundreds of thousands of families a year will be celebrating all clears, not mourning losses?
I thank my honourable friend for his question and offer my condolences on the loss of his Auntie Hilary. And yes, this plan is designed to make sure that an extra 320,000 people at the end of the course of this plan will have had their lives saved or be living well with cancer after their 5-year diagnosis. And we want to make sure that everybody gets that opportunity regardless of where they live.
Adrian Ramsey.
Thank you, Madam Deputy Speaker. I welcome the National Cancer Plan and in particular the Minister's focus on early diagnosis and on ending the scandal of postcode inequality. Cancer Research UK has highlighted that limited funding could significantly impact the progress against this plan. So can the Minister assure us that she is allocating funding in order to meet her own rightful ambitions, and is she engaging with Cancer Research UK and others in the sector on the funding needed?
Minister.
I thank the honourable member for his question. Yes, I can confirm that. And, you know, it's not always about throwing extra money at things. It's about using the resources we have in a better, more targeted way to be more impactful. I have worked with Cancer Research UK from day one of developing this plan. They have run right the way through it, and we'll continue to work with them as we move forwards to make it a reality.
Peter Swallow.
Thank you, Madam Deputy Speaker. This week marks 17 years since my mum died of lung cancer. She was just 58, I was just 15. So last week when I visited a local lung cancer screening service in Bracknell and heard how they're using AI to speed up diagnosis, it was personal. Can the Minister say a bit more about what we are doing to roll out schemes such as this, to make sure that more families like mine don't have to suffer the loss of a loved one to this terrible disease?
I thank my honourable friend for his question, and lung cancer is a cancer that's particularly impacted my family as well. And yes, we are rolling out lung cancer screening nationwide by 2030 because we know that this makes a huge impact on outcomes. I myself have seen how amazing the AI tools are at identifying discrepancies in lung CTs, and actually found out that I was quite good at identifying them as well. It's an untapped talent. But AI is meaning that we can catch them sooner. Lung cancer is often not caught until it's stage 3 or 4. Using AI means we can get it stage 1 and 2. We can treat people early and we can save lives.
Ayub Khan.
Thank you, Madam Deputy Speaker. Can I welcome and thank the Minister for presenting this National Cancer Plan. Her conviction, enthusiasm and passion is clearly seen from the dispatch box, especially the disparity, regional disparity, but we also have disparity within constituencies. My constituency of Birmingham Perry-Barr operating 20% less than national average. So I'm pleased that the Minister will be addressing that. But my question is, it's been reported that there are 64 radiotherapy machines which are running over the 10-year life span, and we know that we have 28 new machines which cost the NHS 87,000 appointments. What more will the government do to get new machines?
As I've set out already, we have already invested 70 million into the new LINAC machines, and we're using AI to support oncologists to use those machines more effectively. Through the spending review, we're providing 15 billion in operational capital for local priorities. It is down to local ICBs and local trusts to identify the need and identify what they want to purchase in their areas, but we're providing the support and the guidance to help them do that.
Lewis Atkinson.
Thank you, Madam Deputy Speaker. I want to thank NHS cancer teams in Sunderland doing incredible work for our constituency. Other members have already mentioned the unacceptable variation in NHS performance against waiting times, and I commend the Minister's focus on that. But I wonder if you could say a little bit around the variation of waiting time by tumour site. In November last year, 82% of skin cancers were tracked within 62 days, but that was only 58% for gynaecological cancers. So could you say more about the variation by tumour site?
I thank my honourable friend for his question. Yeah, this is a really key issue, and obviously for some cancers they are perhaps an awful lot easier to get at, and so they're a lot easier to diagnose sooner. We are looking at how we can roll out screening wherever appropriate, and increasing access to things like the liquid biopsies, which I talked about in the statement, so that people can get their diagnoses sooner.
Anne Davis.
Diolch yn fawr, Madam Dirprwy Llefarydd, and can I thank the Minister for this announcement today, because at the end of the day, cancer will affect 1 in 2 of us. Those are the statistics that we have now. And can I thank colleagues as well, just for highlighting the difference between rural and urban and how each of us has our treatment. Because in Wales, we don't even have a plan yet, to be honest. And without urgent action, inequalities and long waiting times will continue with cancer for the people of Wales. And that's why Plaid has developed its own cancer plan with input from the European Cancer Organisation. So can the Minister, what does the Minister make of the decision of Welsh Labour colleagues not to implement a plan in Wales? And why haven't we got parity? Diolch.
I thank the honourable member for her question and can assure that we are working with Welsh counterparts to make sure that there is equity of access to resources and to information, and we will continue to do so.
Julie Minns.
Madam Deputy Speaker, the reality is that if you live in a big city with access to a university teaching hospital, your access and your treatment for cancer will be different to that in a town and a small city like Carlisle, where we face challenges in recruiting and retaining specialist consultants. So, does the Minister agree with me that this plan, combined with the pioneering approach to training doctors at the new Cumbria Pears Medical School, will begin to repair and fix those inequalities my constituents experience?
Absolutely. I thank my honourable friend for her question. And this plan is going to support people, particularly in her constituency and all by expanding access through community diagnostic centres, personalised neighbourhood-based cancer care. And we're also focusing on making sure that we're recruiting more cancer specialists for rural and coastal areas and supporting that through the workforce plan.
Chris Murray.
Thank you, Madam Deputy Speaker. Can I strongly welcome this statement from the Minister today, which I found quite emotional, and I know that many of the Honourable Lady's friends are, in many senses, pleased to see her making it today. The Minister said that cancer mortality is higher and survival is lower in Britain compared to other European countries. And what this means is cancer patients have to go abroad seeking treatment themselves and then come back, like Charlotte Montague, and advocate for that treatment to be incorporated in the NHS here. What will the plan do to bring Britain more in line with European countries and so people don't need to go abroad to seek treatment?
Thank my honourable friend for his question. We are learning from comparable countries, and by looking at what they've achieved, that's how we've begun to put together this plan. Not only that, but we want to make sure that for those new innovative treatments, that Britain is the place to come for those clinical trials. So not only are we looking to learn from other countries with treatments that they already offer, but we're looking to have our homegrown new treatments, new innovations through our clinical trials accelerator in the UK.
Sarah Smith.
Deputy Speaker, and I want to congratulate my honourable friend on this ambitious and much-needed plan. She met with my constituent Lorraine. Lorraine lost her daughter Millie and set up Millie's Smiles, a charity that offers to families arriving at hospital across the country a welcome pack of essential items to help them on their journey. And I know she will welcome today the reference to improving non-clinical and supportive care for children in this plan. But does my honourable friend agree with me that it is only by working together with charities, with families, with researchers and the health service that we will deliver on this plan for everybody across the country?
My honourable friend for her question. I absolutely agree with her. It's my pleasure to meet with Lorraine. And if I can very quickly just say, when we met with her, we were talking with officials and she was explaining how she didn't have what she needed for her daughter when they were sent to the specialist care, you know, straight from the hospital she'd been to A&E. And one of the officials was like, why couldn't you go and get it? And we all looked at him and said, nobody was leaving her. No one's going to leave that child. And that's why this cancer plan recognises that particularly children, young people and families need that wraparound care so that they can support their child and their families best.
Douglas McAllister.
Deputy Speaker, I congratulate the Minister on this excellent and ambitious plan. If we are to achieve its targets, improvements need to be made on delivering earlier and better diagnosis, particularly in cancers with extremely low survival rates, such as acute myeloid leukemia, which has a 5-year survival rate of just 22%. And in my Western Bartonshire constituency, 46 people lost their lives to leukemia over the last 5 years. I've lived with leukemia over the last 18 years. Can the Minister confirm that improvements will be made in survival rate of acute myeloid leukemia as part of this plan?
Thank my honourable friend for his question. As he knows, I don't need to tell him, brain tumours, leukaemias and other less stageable cancers can't be assessed in the usual way. So we do need different measures to understand how early they're being caught. This is why this plan commits to regularly publishing data on emergency cancer diagnoses as a key indicator, exposing where these cancers are picked up too late so that we can drive earlier detection and focus attention where it's most urgently needed.
Anna Dixon.
Speaker, my honourable friend, the Minister, saw yesterday firsthand the amazing care and support that Maggie's centres provide not only to patient survivors but also to their families. What role will charities and voluntary organisations like Maggie's play alongside the NHS in delivering improved care for cancer patients and their families?
Friend for a question. They play a crucial role. It's why we chose to launch our National Cancer Plan at a Maggie's Centre yesterday, because we cannot do this alone. Charities, support organisations, family groups, tiny little charities that are run by the family of somebody that suffered a very rare cancer and they're run from a back bedroom, all have a role to play in how we bring forward this cancer plan. And what I'm most proud of is this is not the government's cancer plan. It is this country's cancer plan. And every voluntary sector, community organisation and charity has got a role to play. And I'm delighted and look forward to working further with them all.
Lindsay Farnsworth.
Thank you, Madam Deputy Speaker, and I thank the Minister for this excellent plan. In 1989, my wonderful mother Margaret passed away from bowel cancer. She died about 6 weeks after she was diagnosed. She hadn't wanted to go to see her GP because she didn't want to be a burden on the already overstretched NHS. So can the Minister join me in encouraging anyone who fears that they might have bowel cancer to go and see their GP? And can she provide assurances to those people regarding screening and early diagnosis for bowel cancer?
For her question. We've extended NHS bowel cancer screening to cover people from the age of 50, and between now and 2028 we're increasing the sensitivity of the FIT test, rolling it out nationally by 2028. So combined with increased uptake, this will deliver 17,000 earlier diagnoses by 2035 and save almost 6,000 lives.
Dr Scott Arthur.
Thank you, Madam Deputy Speaker. This is a plan, I think, which gives so many people so much hope. And it's great to see it being delivered with so much passion and energy, actually. It's absolutely fantastic. It's clear why the Minister is really respected by so many people right across the sector. I've never seen a statement delivered with so much energy, I have to say. It's fantastic. More of this, please. More of this, please. So I do thank the Minister for her leadership. And also, I have to say, for supporting my Rare Cancer Private Members Bill from our very first day in office and finding a place in this plan for it. So I really do thank her for that. So 3 very brief questions. Will rare cancers be recorded and reported separately as part of the plan? What influence will the Cancer Board have over the delivery of the plan? I think this is quite important. And lastly, others have spoke about community organisations. In Edinburgh South West and Gorgie, we have House of Hope, which is led by Lisa Fleming. She delivers a fantastic support service for women who have a breast cancer diagnosis. The next time the Minister is in Edinburgh, will she visit Lisa and her team?
I thank my honourable friend and commend him for all of the work he's done, particularly on the Rare Cancers Bill, which the Government is delighted to support. Not only has this plan got the first ever chapter on rare and less survivable cancers, but we will be appointing the first ever clinical lead for rare cancers, whose job it will be to make sure that rare cancers are properly counted, are properly registered, and that we continue to deliver on this area. And yes, I'll be delighted next time I'm in Edinburgh.
Can I thank the Minister for her statement this afternoon?